I will give it just a few more seconds for more people to join. Okay, well, hello everybody. Welcome to today's webinar hosted by the Association of Food and Drug Officials. My name is Jerry Voitala and I'm the Executive Director of IFPTI. Thanks for joining us. Today's webinar will highlight some of the IFPTI Fellowship in Food Protection Cohort 9 Fellows as they present their research projects. This is the second of 3 installments of presentations, so be sure to mark your calendars for the 3rd session next Friday. These presentations are the culmination of a unique year-long leadership program funded under a cooperative agreement by the FDA Office of Training, Education, and Development and by AFDO. Today, we will experience 3 project presentations. As for the format, the fellows have been given strict requirements to consolidate their presentations of their projects into a 10-minute segment followed by questions from the audience. So as you're watching the presentations and you think of a question and you'd like to ask a question, go ahead and type that into the Q&A, and that can be found at the bottom of your screen in the Q&A box. And just, if there's a lot of questions coming in, we may not get to all the questions in the interest of time, but just feel free to contact the fellows by email, and you'll see their email addresses on their presentations, or you can contact IFPTI if you'd like to learn more about their projects. At this point, let's just go ahead and begin. I think we start with Grady. Grady, would you like to kick us off today?
Yes, sir. Thank you, Jerry. Let me go ahead and get my screen shared. All right. Good morning, good afternoon, everyone. We appreciate you being here. My name is Grady Burquist. I am an RS with the City of Lubbock Environmental Health Department, and I am a member of the IFPTI Fellowship Cohort 9. The title for my research project is the Norovirus Intervention Strategies in Retail Food Safety Programs. And we will get right into it. A little bit of background on norovirus. It originally is known as the Norwalk virus after an outbreak in an elementary school in Norwalk, Ohio. They are a group of non-enveloped single-stranded ribonucleic acid viruses, also the leading cause of vomiting and diarrhea from acute gastroenteritis among all ages in the United States, with 19 to 21 million cases annually. And it is spread through the fecal-oral route, most commonly spread by touching contaminated surfaces, shaking hands, and then touching your mouth without cleaning your hands. And what is the process for reporting norovirus? It starts with the local health department collecting specimens and epidemiologic data. The specimen genetic sequence data is reported to CaliciNet. CaliciNet it was launched by the CDC in 2009. It's a national norovirus outbreak surveillance network made up of federal, state, and local health laboratories to collect information on norovirus strains. And then the epidemiologic data is reported to National Outbreak Reporting System, or NORS, and that is a web-based platform used by state, local, and territorial health departments to report all waterborne, foodborne, and enteric disease outbreaks. And that data is then collected by the Centers for Disease Control and Prevention, the CDC, They review, summarize, and publish the submitted information to the Norovirus Sentinel Testing and Tracking, or Norostat. And so the question now is, who is reporting norovirus outbreaks? Currently, there are 12 states that report norovirus outbreaks to the CDC and Norostat. Those states being Minnesota, Wisconsin, Michigan, Oregon, Wyoming, Nebraska, Ohio, Massachusetts, New Mexico, Tennessee, Virginia, and South Carolina. And that brings me to my problem statement of unique factors and trends relating to norovirus outbreaks in these states and jurisdictions that currently report norovirus to the CDC may not be known. And my research questions that I'm asking are, how are retail food safety programs utilized when investigating norovirus outbreaks in these states and jurisdictions? What intervention strategies do the states and jurisdictions employ to control norovirus in retail food establishments? And lastly, what correlations with number of reported outbreaks and intervention strategies exist in these states and jurisdictions? The way that I conducted this study was through reviewing existing CDC data on reported norovirus outbreaks from 2012 to 2018. That data was collected directly through the NORS dashboard. And then I conducted a telephone questionnaire and interview for managers within the 12 reporting state retail food safety agencies. The study population is the retail food safety regulators from the 12 reporting states. And to get into the results now, 4 of the 12 reporting states responded to my inquiries. That gives me a response rate of 33%. In all the responding norovirus, in all the responding states, norovirus investigations are led by state or local epidemiologists with retail food safety programs used in a supportive role when investigating retail food establishments. The numbers for these cases are for the states. Michigan reported a total of 2,621 cases from 2012 to 2018. Oregon reported 1,275 cases. Minnesota reported 3,129, and Nebraska reported 112. The intervention strategies, all responding states utilize similar intervention strategies, including educational materials and presentations to facilities during an outbreak. Minnesota reported slightly more in-depth strategies with retail food safety programs used for stool sample collections, contact tracing, employee health information, and requiring food facilities to assess employees for illness. Minnesota is also enrolled in EHSnet. That is an online collaborative forum of environmental health specialists that research restaurant food safety policies and practices. So in conclusion, there were no identifiable trends relating to intervention strategies and the number of reported norovirus cases. The states in which more intervention strategies are utilized by food safety programs, Minnesota, does not show a reduced number of norovirus cases. And all state retail food safety programs that responded were used in a supportive role to the state or local epidemiologists during a norovirus investigation. With that, my recommendations for further study would be a study on increased utilization of retail food safety programs by state and local health departments during norovirus and any foodborne illness investigation, and a study on the efficacy of educational outreach and information retention among food workers in the reporting states, and an analysis of intervention strategies in the prevention and awareness of illness. And with that, I would like to acknowledge the International Food Protection Training Institute for accepting me into this program and allowing me to further my professional experience, Brian Collins, my mentor, all of Cohort 9 for their support, Wendy Fanisell from the FDA for her expertise and guidance, as well as Stephen Walker, my supervisor, and the City of Lubbock Environmental Health Department for all their encouragement and support during this year. And lastly, do we have any questions for me?
Okay, well, now's your time. So if you have a question for Grady, go ahead and click on your Q&A box and type your question in, and we'll read those. And Grady, I think we have one already here. I think one question is, why do you think there was a low response rate?
I would say that the low response rate is, I'm trying to get in touch with retail food safety programs, and I was having to go through some health departments to get in touch with who I needed to be in touch with. And across the country, we were experiencing a large pandemic. And I believe without that, or if that was not happening at this time, I think my response rate could have been much higher, if not 100%. And so I think COVID was a relatively large reason for the low response rate to this.
Okay. And another question here, did you conduct an electronic survey or just phone calls?
It was a phone call survey, and I called them, asked them my set of questions over the phone.
Okay. And another question for you. Minnesota is active in EHSnet, and do you think that has some effect on the number of cases?
I believe that could have an effect in the awareness of the illness. The more people that know about it, the more likely you are to get tested. Or if you have the symptoms, the more likely you might think it could be norovirus. So I believe that has a role in the number of cases through awareness of the illness.
Okay, and here's a question. Did any respondents share if they used regulatory actions, such as closing facilities?
They did not. That was the majority of the intervention strategies that they mentioned were educational and through disseminating information to the facilities. So whether that be information directly from CDC, fact sheets from CDC, they would give that to the facilities, and presentations of those fact sheets if they're not handing them directly to the facility.
Okay, and here's a question about the food code. Did your study determine if any changes are needed to the food code?
My study did not determine if any changes are needed. During the research, I did look through the food code, and I don't believe that this study would be sufficient enough to say that there needs to be changes.
Okay. And here's another question. What do you think the reason was for the number of outbreaks didn't go down even after all the education and outreach by the agency?
I believe that would be suited for another study on information retention of employees and facilities, and because you can talk to them all you want, but if they're not learning that information and putting that information into work, I think there could be room for more study on information retention concerning that.
Okay. I don't see any other questions coming in, Grady. So thank you very much for your presentation today. Great job.
Thank you.
Okay. Well, now we're going to transition. If you could give up control, there you go. And then we're going to turn to our next presenter. Andy, would you like to take control?
Yep. Does that look okay?
Looks good.
Okay. Good afternoon. My name is Andy Chevrofields, and I'm the Public Health Inspection Manager from the Vermont Department of Health. Thank you for joining us today. Today, I will be presenting my research on the effectiveness of employee health policies at retail food service establishments in Vermont. I really became interested in this topic after involvement in several illness investigations where we discovered food employees were working while experiencing symptoms of foodborne illness. I really wanted to see why this might be happening and see if there's anything we can do about it. So let's talk more about the background of this study. States that reported to the CDC National Environmental Assessment Reporting System between 2014 and 2016 reported that over half of foodborne illness investigations identified at least one contributing factor associated with a food employee that was ill or infectious while working. An example of this in Vermont was an investigation that identified 479 cases involved in a norovirus outbreak at a food service establishment where 13 employees tested positive for norovirus. Interviews with establishment management revealed that a stomach bug was going through the kitchen and that some employees had toughed it out and worked through their symptoms. Though employee health is a major focus of food service regulations, we still see numerous outbreaks related to ill food workers. Let's take a closer look at food service manager and employee habits in relation to foodborne illness. Previous Environmental Health Specialist Network, or ESNET, studies concluded that food employees in restaurants without an employee health policy were more likely to have worked while experiencing vomiting or diarrhea. During food employee interviews with ESNET states, almost 20% of respondents said they had worked one or more shifts in the previous year while ill with diarrhea or vomiting. The same study suggested that a small percentage of managers also worked while experiencing diarrhea or vomiting. These findings strengthen the importance of clear communications between employees and managers and highlight how managers influence the culture of food safety within the establishment. Besides managerial influence and how managers need to be a role model for their employees, let's examine what other influences may be involved. Other factors that may lead to working while ill include loss of income, loss of job or employment status, personal feelings of guilt or not feeling supported to stay home, and the feeling you can tough it out and make it through your shift. These are all pressures that can be addressed, especially if communications are established between employees and management. Moving on, let's briefly touch upon what is required in Vermont and by the Food Code when it comes to employee health policies. The current Vermont health regulations for food service establishments requires employees to report to the person in charge any illness, condition, or symptom that might cause foodborne illness, but no specific employee health policy is required. Additionally, food protection manager training is not required for the person in charge in Vermont. The Food Code requires employees to be informed in a verifiable manner of their responsibility to report to the person in charge information about their health and activities as they relate to diseases that are transmissible through food. Documentation of employee understanding this responsibility is required, but a written policy is still not unless bare hand contact with ready-to-eat food is allowed at the establishment. This brings me to my problem statement. Employee health policy effectiveness in Vermont retail food service establishments is not known. To help solve this problem, I have developed the following research questions. How aware are food service employees and managers about employee health policies? What training is provided for employees and managers on employee health policies? What foodborne illness symptoms are employees and managers aware of? Do food workers report to work ill? And if so, how often does this occur? And what policies do food service establishments have to support employees staying at home? Now I'll review the methodology for my research. I first developed an electronic survey with Alchemer, which is formerly known as Survey Gizmo. Next, we randomly selected a group of retail food service establishments. These establishments were contacted by phone to arrange participation by a manager and an employee at the establishment. This effort lasted approximately 4 weeks, and at the end of each week, contacts collected were sent an email or text message with a link to the survey, depending on their preference. When the survey closed, the responses were analyzed by Alchemer reporting tools and Microsoft Excel. Now I'd like to provide a closer look at the respondents of our survey. Of the 3,100 retail food service establishments in Vermont, 495 were randomly selected to be contacted. After the calling efforts, 294 supervisors and 182 employees agreed to participate. In the end, we received completed surveys from 189 identifying as supervisors and 50 identifying as an employee. Now let's see what our respondents had to say about employee health policies. First, let's look at overall employee health policy awareness. As you can see, almost 90% of respondents indicated that they had either been told about the policy or had seen it. Respondents also reported employee health policy as being documented mostly by a poster, employee handbook, or electronic document. Next, we're going to look at training elements related to employee health policy awareness. Of those workers that indicated awareness of an employee health policy, 87% they had received training on the employee health policy at their job. 78% of all managers indicated that they provide training on the employee health policy. In addition to asking about training on employee health policies, we also asked whether managers had completed a food protection manager training course, or if employees had completed a food handler or food protection manager course. 73% of managers and 60% of employees had this additional training. With training established, let's look at how our respondents did in recognizing foodborne illness symptoms. Through this study, we wanted to see how managers and food employees were able to identify symptoms that are commonly associated with foodborne illness according to the food code. In the survey, we inserted 2 symptoms that are not listed in the food code as being associated with foodborne illness. Those were headache and runny nose. As you can see, diarrhea and vomiting were identified consistently. Looking at the other 3 symptoms identified in the food code, jaundice, sore throat with fever, and infected cuts with burns with pus on hands and wrists, these were identified less frequently. Moving on, let's take a look to see implementation of an employee health policy in action. Overall, 16.3%, or 39 total respondents, indicated they had worked while experiencing a foodborne illness symptom. Specifically, diarrhea was indicated by 11.7%, sore throat with fever by 8.4%, vomiting 4.6%, and 1 respondent indicated they had worked with an infected cut or burn with pus on hands or wrist. Though not shown here, managers that completed a certified protection manager training course were less likely to report to work with diarrhea and vomiting. To wrap up results, let's look at policies that establishments have to support employees to be able to stay out of work when they're feeling ill. To look at the results for questions related to policies that encourage workers to stay home, we'll compare results from all respondents, managers and employees, to only those that reported working while ill, again combining managers and employees. 57.1% indicated that they get paid for a missed shift due to illness. When looking just at those that reported working while ill, there's a reduction to 41%. 20.5% of those that reported working while ill also indicated that they worry about losing their job if they have to miss work because they're sick, while only 7.5% indicated this worry in the entire respondent pool. When asked of whether they feel supported by their employer when they need to miss a shift, 83% of all respondents indicated feeling very supported or supported, while this was reduced to 61.5% for those that worked while ill. Those reporting working while ill said that they were asked about their health and foodborne illness symptoms slightly more than all respondents put together, but these were all managers. So when we look only at the employees that reported working while ill, none indicated that they had ever been asked about their health regarding foodborne illness. So now let's look at some of the conclusions we made from the results of our study. First, food service managers and employees are generally aware of employee health policies. Training is provided in different formats, whether it's in-house, in-person, or through remote learning. Food service managers and employees are more likely to recognize diarrhea and vomiting as common foodborne illness symptoms, but are less likely to identify jaundice, sore throat with fever, and infected cuts and burns with pus as common foodborne illness symptoms. Though diarrhea and vomiting seem to be clearly understood as foodborne illness symptoms, implementation of employee health policies may be lacking. Completion of a certified food protection manager training course appears to reduce the likelihood of a manager reporting to work while ill. Also, if a worker does not receive paid sick leave, results indicated they are more likely to work through their foodborne illness symptom. Support and communication are essential for ensuring proper implementation of employee health policies. Now let's discuss some potential changes or improvements that can be used to reduce employees reporting to work while ill. First, I'd like to increase outreach about foodborne illness symptoms to retail food service establishments. This can be done by updating information on our website and providing key information in quarterly newsletters. Additional work to identify opportunities to reach food service workers with different methods, either through social media or electronic technologies, should be explored. Vermont should adopt the current version of the Food Code to support greater emphasis on reporting foodborne illness symptoms and the documentation of training and employee health policies. This will include requiring standardized training, such as a food protection manager training class for the person in charge. I'd like to improve assessment methods for determining knowledge of foodborne illness symptoms during inspections. And we'll support legislation that enhances paid sick leave benefits on a local and national level. The completion of this project wouldn't be possible without the support from the Vermont Department of Health and IFPTI. Specifically, I'd like to thank Lori Cragen and Liz Worsing from the Vermont Department of Health, Brian Collins, my IFPTI mentor, and Gerald Watoya from IFPTI. The Vermont Department of Health Public Health Inspection Team. Without your efforts, this project would not be possible. So thank you for all your time and enthusiasm for this project. And I'd like to thank the other IFPTI mentors and staff and all the Cohort 9 fellows that someday I hope to meet and celebrate our accomplishments in person. That's all I have today, so thank you very much.
Okay, thank you, Andy. Okay, now's the time to go to the Q&A box at the bottom of your screen and type in any questions you have for Andy. Very interesting project. Okay. Okay, Andy, here's a question. Do you think your agency would support manager certification?
Yeah, so it has not been required ever in this program, and so I think our agency will support it, and I think the study will help support that. And I think there's just some work to make sure that industry will also support that as well. But yeah, I definitely think the Vermont Department of Health will be in support of that.
It looks like a related question to that. Have you shared your study with your agency, and will your agency be instituting any of your recommendations?
Yeah, so I've done this presentation for a group of my team and our program and the food and lodging program, and we'll be working on policy development. Before the pandemic, we were kind of in process of doing a rule update that did include the adoption of the food code, and that had to take a pause. So this will definitely be helpful in moving that forward when we're able to get that back on the front burners.
Okay, and we have another question. Based on your research, what are some of the messages you would like to provide to food service establishments about employee health?
Yeah, I think my big takeaway is that communication is so important. Managers really need to take a lead and help employee health be a daily conversation with their employees and really be a role model. And actually stay home when they're sick, and let their employees know that that's the right thing to do. For example, there were 20 managers that reported in our study providing training on employee health policies that also reported going to work while sick. So that's something that needs to change. And I also hope that more food service establishments can find ways to support employees by providing access to paid sick leave and other resources so that they're able to stay home when sick.
Great. Okay. One more question. How do you think the COVID-19 pandemic had an impact on your project?
Yeah, the pandemic has made employee health and illness really to be at the forefront in the food service industry. For this project, we did an open-ended question about just general employee health and foodborne illness, and a lot of the answers mentioned COVID-19, symptom checking, keeping employee logs, and having restrictions of employees that were symptomatic. So I think it really brought employee health into the conversation. So I mean, I think that will be helpful. Looking specifically at some of the results in our study, I think almost 20% indicated that sore throat with fever was a common foodborne illness, though almost 100%, so almost 98% indicated sore throat with fever was a symptom that should require a worker to stay home. So, fever and sore throat, they're common COVID-19 symptoms, but also listed in the food code as a foodborne illness symptom associated with streptococcal sore throat outbreaks due to contaminated hands and food. So I think there's definitely an opportunity from the pandemic to really bring employee health into a big discussion.
Okay, and now we're getting some questions over on the chat box. How can regulators support industry in developing their practices to reduce the occurrence of workers from reporting to work ill?
Yeah, I know the FDA has some guidance documents, workbooks on employee health policy development. I think we have a responsibility to promote messaging about staying home when you're sick and promoting paid sick leave benefits in the state. Vermont has required paid sick leave, but it's very limited and not all employees qualify. So I think we can work with industry to help move that type of legislation forward. And I think that'll be important in the future.
Okay, and here's the related question. Were any establishments implementing exclusion or restriction procedures for ill workers that you ran across?
Can you repeat that, Jerry? I'm sorry.
Yeah. Were any establishments implementing exclusion or restriction procedures for ill workers in your study?
We didn't ask that specific question, but in some of those open-ended questions, there definitely was some mention of those practices.
Okay. Well, I think that's the questions we have.
Okay.
And so, Andy, I want to thank you for your presentation today. Great job. Thank you.
Thanks, everybody.
Okay. Well, we have one more presenter this afternoon, and that is Sarah. So, Sarah, if you take control, we'll listen to your presentation.
Gladly. All right. Hello, everybody. My name is Sarah Morrow. I am a food safety specialist with the Ohio Department of Agriculture, Division of Food Safety. Would like to thank you all for sticking around and watching my presentation about the regulation of edible hemp products. So hemp is a member of the cannabis sativa L family. It's a crop that's been around for many, many years, utilized for many, many different purposes, everything from FDA-approved epilepsy treatment to ropes, textiles, food additives, things like that. Hemp is often confused with its relative marijuana. However, hemp is different than marijuana in that it typically has a low THC concentration, THC being the element in the plant that causes the psychoactive effects that are commonly associated with marijuana products. But because hemp is often grouped in with marijuana, it has been on the Schedule I controlled substances list for quite a while. However, in 2014, under the USDA Farm Bill, the growing, cultivation, and processing of hemp and hemp products was allowed for research purposes. Based on the information gathered from those research programs in the 2018 USDA Farm Bill, hemp was removed from the Scheduled I controlled substance list. This now meant that hemp could be grown, cultivated, and processed in states or tribal nations that had a USDA approved state hemp program. One of the main requirements under the USDA state programs was that the Delta 9 THC concentration must be below 0.3%. It's important to note that Delta 9 was the only variant of THC that was addressed in the 2018 USDA Farm Bill. It's also important to note that FDA currently only recognizes as safe hemp seeds and hemp seed oil to be added to food. They do not recognize any other hemp products such as CBD oil that are allowed to be added to food and distributed in interstate commerce. So as of September 1st of 2020, there were 42 states and tribal nations that had USDA approved hemp programs under the 2018 Farm Bill. There were 21 states and tribal nations that were in process, and there were a number that wanted to continue to operate under the 2014 Farm Bill under research purposes. And based on the relatively new nature of the passage of the 2018 Farm Bill, there's limited information on what challenges and violations state regulatory agencies are facing regarding the licensing and inspecting of hemp food and hemp food component processors. And in order to address this problem statement, I developed 4 research questions that I wanted to answer. So my first question was, what level of preparation are states finding when conducting pre-opening or pre-licensing inspections of hemp processors? What violations are states finding when conducting routine inspections of hemp processors? Have there been any foodborne illness outbreaks or recalls associated with these hemp producers or hemp products? And what can states learn about regulating hemp products based on the experience of other states that currently have USDA approved hemp programs? In order to answer these research questions, I developed a survey through SurveyMonkey that was emailed to the hemp program contacts that were available through the USDA website. And that was just to generate or to gather general information related to their hemp programs. I then conducted a follow-up phone interview to gather specific information related to those states that allow hemp in food products related to violations, challenges, recalls, and things like that. So based on that methodology, I ended up conducting phone interviews with 9 states, and those 9 states were the only states as of September of 2020 that allowed hemp in their food products. The other 11 states had approved programs, but they did not allow any hemp products in food, with the exception of the hemp seed and the hemp seed oil that was already approved under FDA. So those 9 states are what my results are going to come from. So when I asked those 9 states about their initial licensing deficiencies, 4 of the states reported that there were often food labeling deficiencies. And that means things like undeclared allergens, incorrect statement of responsibility, statement of identity, things like that. 4 states also reported that the THC labeling on the food product itself was incorrect, meaning that the THC concentration of the product was either higher or lower than what was declared on the label. 1 state each also reported that they had one processor who wanted to utilize unapproved sources for either the hemp component or the food component. 1 state reported that they had a producer that wanted to conduct interstate distribution, which is not currently allowed under FDA rule. 1 state reported there was improper THC concentration. A facility thought that they could have a higher THC concentration in the product than they were actually allowed. And one state reported that there was an inadequate facility or basic good manufacturing practices issues upon conducting that initial licensing inspection. When I asked about routine inspections, 4 states reported that they had found producers operating without a permit or without a license, meaning they just opened up shop and began producing these hemp products without going through the proper process of obtaining licensure or permitting. One state reported that they require food safety plans for all of their hemp producers, and they often had producers that began operating without having a food safety plan. 2 states reported unapproved source issues with, again, either the hemp component or the food product component. And 5 of the 9 states reported that there were often labeling issues. And that takes into account not only the food labeling, such as missing allergens, the statement of responsibility, but also listing of improper THC concentration or not listing the THC concentration on the labels at all. It's important to note that 3 states have not yet documented, at least as of the time of conducting the phone interviews, had not yet documented any violations in any of these hemp processors and were utilizing enforcement discretion when conducting those inspections. I also asked if these states had received any complaints related to these hemp processors. 3 states indicated they had received complaints. 2 states said that complaints were received regarding the THC concentration being perceived to be too high in the food products. So the person making the complaint indicated they got quote unquote high off of that product. And 1 state indicated that they received complaints about producers operating without a license or a permit. I also asked the question about recalls and if they had conducted any recalls within their states related to hemp containing food products or hemp producers. Again, 3 states indicated they had conducted recalls. 1 state had a recall due to a high lead concentration in the food product. And 2 states had to or conducted recalls due to the THC concentration in the food product being higher than what was allowed through their hemp program. I also asked about the challenges of not only creating but implementing these hemp programs, and the answers were pretty uniform amongst all the states that responded. Program budget was a big challenge indicated by all the states that I talked to, not only trying to determine how much of a budget was needed for these programs, but also trying to find the money for these programs to be able to create and implement them. Staffing levels and staffing training was also a big challenge. Finding training materials, creating training materials, and trying to determine how much staff was needed, not only for an inspection side, but also on the administrative side was a challenge. Education, again, on the industry and the public side, getting information out about what is hemp, what do the hemp programs contain, and what do these hemp producers need to do to come into compliance was a big challenge. Political climate was indicated by a couple of the states as well when creating the hemp programs, taking into account all of the varying opinions and information from the various political sides within their state. But every state indicated that the biggest challenge was the lack of guidance related to these hemp products. And that's not only on an industry level of how do we grow this, how do we process this, but also on a federal level from an FDA side and a USDA side. What are the safety aspects of these products? Give us information about how we can implement these programs and things like that. That was uniform amongst all of the states that responded. So based on that, I asked, what advice would you have for states that want to create a hemp program? And all the states said, reach out for help. You're not alone. Ask some of the states that had already created hemp programs, what's working, what's not working. If you could do it over again, what would you do? And definitely the creation of education plans was indicated to be something that all of the states would recommend for other states. And those education plans, they indicated, should be done at the creation of the hemp program or while the hemp program is being created, not only for industry, but also for the industry, public, and for the political field as well. And more recently, some of my later respondents indicated that when creating the hemp programs, it's a good idea to leave it open to be able to address things like a Delta 8, which is another form of THC, which is not addressed in the 2018 Farm Bill. But Delta 8 can also cause psychoactive effects similar to the Delta 9 THC. So the states indicated that they don't really know how to handle Delta 8 right now, because even though it does potentially create those psychoactive effects, there's nothing in the regulations or in the USDA Farm Bill that gives them guidance on how to handle that. So being able to address that down the road would be very beneficial. So based on the results of the survey, there appears to be a general lack of guidance for hemp and hemp-containing food products. That's not only on the regulatory side, the inspection side, or the creation of these hemp programs, but also on the industry side related to hemp programs and how these things need to be regulated. There also seems to be a little bit of a lack of collaboration amongst industry, the regulatory side, as well as the public side in working together to create and implement these hemp type programs. And there seems to be a need for food safety training geared specifically towards hemp producers. A lot of the states indicated that many of their hemp producers had never produced food products before, and it would be beneficial to have food safety related to hemp products geared specifically towards the types of products that they are making. So based on that, my recommendations would be establish collaborative efforts, not only in the creation or early stages of implementing hemp programs, but continually. Keeping those collaborative efforts between regulatory, public, industry, and nonprofit agencies is going to help these hemp programs be effective. Creation of sample training programs that could be disseminated to various states so they can be tailored specifically to each individual state's hemp programs would be very beneficial as well. I definitely recommend continuing to gather information. 2018 was not that far or that long ago, so we don't have a ton of information related to the safety and the efficacy of these hemp products and these hemp programs. So continuing to gather information, maybe even including the tribal nation information, would be beneficial. And of course, continuing the safety research, not only on the food safety side, but on the THC component side to determine what should be allowed, what can be allowed, and how do we make sure that these products are the safest products that they can be. I would like to take a minute to thank all of these state employees who took time out of their very busy schedules in a very difficult year to not only answer my SurveyMonkey survey, but also to chat with me on the phone and answer my questions. And everybody was really great to work with. I would like to thank Catherine Fetter, my amazing mentor at IFPTI, who has been very supportive throughout all of this. And of course, all of the other IFPTI staff and mentors. It's just been a really great collaborative effort. And of course, my eternal thanks goes to Terry Gearhart and Jody Taylor, the Chief and Assistant Chief of the Division of Food Safety at the Ohio Department of Agriculture, for not only encouraging me to do this program, but also encouraging me every day in my day-to-day work. And of course, my fellow mentees, we have yet to meet in person, but somehow we have developed a really great bond and a really great camaraderie, and we've supported each other, and I thank you guys for that. And that takes me to any questions.
Okay, thank you, Sarah. Great presentation. And again, go down to your bottom of your screen and click on that Q&A button and type your question in the Q&A box. And I think we see a question already here. Sarah, at what frequency are these hemp products being inspected?
So that was a question that I asked all of the state respondents, and what it came down to was whatever their normal food facilities were being inspected under was what they were inspecting these hemp producers under. Most of them were on a quote unquote high risk food product would be a year to a year and a half. A medium risk product would be a year and a half to 2 years. And then a low risk product would be anywhere between 2 to 3 years.
Okay, great. Looks like a related question here. Are the same inspectors who conduct non-hemp containing food products typically the same who inspect hemp containing food products?
That was all over the board. Each state created a hemp division, and some of the states indicated that it was hemp inspectors that were then going to go in and conduct food safety based inspections in addition to hemp inspections of these processors. And then some of the other states indicated that they were just going to take their food safety inspectors and train them on the hemp side of things, the testing and the records that are required, and have them do the inspections as well.
Okay, it looks like a related question to that one. Many states have cannabis regulation agencies. And did you see any challenges between these and food safety agencies?
Interestingly, there really weren't any challenges. It was more along the side of there needs to be more collaborative efforts. So we have these two agencies, not only the hemp, but some states have recreational marijuana and then the medical marijuana. They are similar products. And it seemed that these states really didn't collaborate with each other when creating these hemp programs, talking to the recreational marijuana or the medical marijuana side of things. So it really comes down to just working on collaboration and getting those agencies together so everybody's kind of on the same page.
Okay, and here's another question for you. Do you know if states have seen any issues with interstate movement of hemp products or internet sales?
They have what was reported to me was that they were enforcing that within their own states. The I did look at the FDA recall and warning letter list, and it appeared that most of the recalls or the warning letters that were issued that were initiated by FDA were mostly due to having health claims on these hemp type products. But it's pretty much up to the states to talk to their producers and make sure that they are not shipping an interstate distribution, or if they do, they know the risks of doing so.
Okay, and I think I'm not seeing any other questions pop up. So Sarah, I want to thank you for your presentation on all three, actually, all three panelists today. Great job, all three. Thank you.
Thank you.
Okay. Well, now remember next week we have 4 more fellows to give their presentations. So make sure you register to attend next week's sessions. Thank you all for being with us today. Just a reminder that AFTO will post these webinars and the slides on their website. Watch for those early next week is typically when those will go up. You'll also find those on the IFPTI website along with the full research papers of the fellows. So you can look at their full research papers on the IFPTI website. So again, thank you fellows today for your presentations. I hope you all can join us next week. And remember to register separately for that session and keep your eye on the AFTO news where you can also click on that to get to the session. So until next week, we'll see you all. Thank you very much. Have a great weekend.